1. What is the primary focus of osteopathic medicine? A. Treating symptoms only. B. Treating the body as a whole. C. Treating the mind-body connection. D. Focusing on prescription medications. 2. What is the goal of osteopathic manipulative treatment (OMT)? A. To adjust the skeletal system for structural alignment. B. To provide surgery for musculoskeletal issues. C. To treat illnesses using pharmaceuticals. D. To focus solely on physical therapy exercises. 3. In adult learning principles, what is the most effective method for retaining information? Repetition. B. Discovery-based learning. C. Group discussions. D. Observational learning. 4. How should osteopathic physicians approach patient care? A. By focusing only on physical symptoms. B. By treating the whole person, including emotional and psychological well-being. C. By prescribing medications for every diagnosis. D. By referring all patients to specialists. 5. What is the primary advantage of using case studies in medical education? A. They provide a detailed theoretical understanding. B. They help learners apply knowledge to real-world scenarios. C. They are easier to understand than clinical simulations. D. They reduce the need for practical training. 6. Which of the following is a key principle of the osteopathic philosophy? A. The body has an inherent ability to heal itself. B. Medication is the best approach for all conditions. C. Surgery should be the first option for treating musculoskeletal issues. D. The mind is unrelated to physical health. 7. What is the role of communication skills in the osteopathic practice? A. They are not necessary in patient care. B. They help in building a trusting relationship with patients. C. They are only relevant for administrative tasks. D. They are important for handling paperwork. 8. In osteopathic education, what is the purpose of formative assessments? A. To evaluate student performance at the end of the course. B. To provide feedback to improve learning during the course. C. To decide the student's final grade. D. To rank students based on their performance. 9. Which of the following is an example of mentoring in osteopathic medical education? A. Assigning students to read textbooks independently. B. A senior physician providing guidance and support to a junior student. C. Evaluating a student's performance with no feedback. D. Encouraging self-study without any direct guidance. 10. What is the best approach to teaching osteopathic clinical skills to students? A. Providing only theoretical lectures. B. Offering hands-on practice with feedback. C. Giving students access to case studies without discussion. D. Relying on textbooks without practical demonstrations. 11. In osteopathic practice, what is the importance of understanding regulatory compliance? A. It is only necessary for administrative roles. B. It ensures the physician provides safe and legal care. C. It is irrelevant to patient care. D. It only applies to billing and coding. 12. How can adult learners benefit from simulation-based education? A. It allows learners to practice procedures in a controlled environment. B. It eliminates the need for real-world clinical experiences. C. It is only useful for theoretical knowledge. D. It does not provide opportunities for feedback. 13. What is the main purpose of using patient-centered communication in osteopathy? A. To ensure that the patient's concerns are understood and addressed. B. To focus on clinical outcomes only. C. To provide medication prescriptions quickly. D. To speed up patient visits. 14. Which teaching strategy is most effective for osteopathic medical students learning OMT techniques? A. Lecture-based teaching only. B. Demonstration and guided practice. C. Memorization of theoretical concepts. D. Reading case studies without hands-on practice. 15. What is the significance of formative feedback in osteopathic education? A. It helps identify areas where students need improvement before final evaluations. B. It is used to rank students against each other. C. It is only necessary at the end of a course. D. It is not important in clinical training. 16. Which approach should be taken when teaching osteopathic students about clinical reasoning? A. Encouraging rote memorization of facts. B. Teaching critical thinking through real patient scenarios. C. Focusing only on textbook information. D. Relying on didactic lectures without case discussions. 17. Why is empathy important in osteopathic practice? A. It helps physicians focus on technical skills rather than emotional concerns. B. It enhances patient trust and improves therapeutic outcomes. C. It is only relevant in non-clinical interactions. D. It is not a priority in clinical care. 18. What does osteopathic education emphasize when developing a treatment plan? A. The use of surgery as a first-line treatment. B. The application of osteopathic manipulative techniques only. C. A holistic approach, addressing all aspects of a patient's health. D. Focusing only on pharmaceutical interventions. 19. In terms of patient education, what should osteopathic physicians focus on? A. Educating patients about medical procedures only. B. Helping patients understand their condition and treatment options in a collaborative manner. C. Encouraging patients to rely solely on medication. D. Reducing patient interaction to a minimum. 20. What is the best method for evaluating student knowledge in osteopathic medicine? A. Memorization of anatomical facts. B. Clinical case evaluations and hands-on practical exams. C. Multiple choice exams only. D. Written essays with no clinical application. 21. What is an example of effective mentoring in osteopathic education? A. A mentor observes the student without giving feedback. B. A mentor provides regular guidance, constructive feedback, and emotional support. C. A mentor allows the student to work independently without interaction. D. A mentor gives students assignments with no follow-up. 22. In teaching osteopathic principles, what is the role of active learning? A. It allows students to observe without participating. B. It encourages engagement through problem-solving and hands-on activities. C. It focuses on passive reading and lectures. D. It minimizes student involvement in their learning process. 23. What is the most effective way to assess the competency of an osteopathic medical student? A. Written exams focusing only on memorization. B. Clinical rotations with direct patient interactions and feedback. C. Classroom lectures with theoretical content. D. Self-assessment quizzes without external feedback. 24. Why is interprofessional education important in osteopathic medicine? A. It fosters teamwork and collaboration between healthcare professionals. B. It focuses on competition between different medical fields. C. It is not relevant to osteopathic practice. D. It limits collaboration to the osteopathic community only. 25. What is the purpose of reflective practice in osteopathic education? A. To encourage passive learning. B. To help students analyze their clinical experiences and improve their practice. C. To assess student knowledge through written exams. D. To limit student input and rely on teacher instructions. 26. Which of the following is a common challenge in mentoring osteopathic students? A. Balancing the provision of guidance and allowing for student autonomy. B. Having too many students in a mentor's group. C. Providing too much feedback at once. D. Ignoring student development over time. 27. How does osteopathic medicine differ from allopathic medicine? Osteopathic medicine focuses on medications as the primary form of treatment. B. Osteopathic medicine emphasizes holistic care, including the musculoskeletal system. C. Allopathic medicine primarily uses osteopathic manipulative treatment. D. Osteopathic medicine does not include surgery in treatment plans. 28. What is the main goal of clinical assessments in osteopathic education? A. To evaluate theoretical knowledge only. B. To assess the student's ability to provide effective patient care in real-world scenarios. C. To evaluate memorization of anatomical structures. To assess how well students perform in written tests. 29. Why is communication training essential for osteopathic physicians? A. It improves clinical outcomes by ensuring that patients understand their treatment. B. It focuses only on administrative tasks. C. It reduces patient interaction and speeds up consultations. D. It is only relevant for social interactions outside the clinic. 30. What is the best way for osteopathic students to prepare for board exams? A. By relying solely on clinical experiences. B. By using study guides, practice tests, and clinical rotations. C. By focusing on memorizing theoretical concepts. D. By attending only lecture-based sessions. 31. What is the role of evidence-based practice in osteopathic education? A. It emphasizes the use of scientific research to inform clinical decisions. B. It is irrelevant to clinical practice. C. It focuses on personal experience rather than research. D. It is used only in administrative tasks. 32. How do osteopathic physicians contribute to the overall healthcare system? A. By focusing on treating symptoms with medications only. B. By providing a holistic approach that integrates the musculoskeletal system with overall health. C. By avoiding communication with other healthcare professionals. D. By focusing on one system of the body without consideration for others.